Hi everyone, welcome again to my channel. This is Ness Caroline. Today I'll be talking on stroke as I promised from my previous video. So like and subscribe for more video. What is stroke? Stroke is when someone is having a blockage in one of the vessels of their brain, blocking oxygenation, blocking blood flow to flow to your brain, therefore causing the brain to start dying. This is called ischemic stroke. When a vessel is blocked, maybe by blood clot, it's totally blocked, that the blood cannot flow, cannot circulate into your brain. Your brain cannot get oxygen, causing your brain to start dying. We also have hemorrhagic stroke. Hemorrhagic stroke is when that vessel is leaking or is broken, and the blood now is leaking into your brain and will cause brain death. Can cause weakness to one side of your body depending on the side that is bleeding. If it's bleeding on your right side, you will get weakness on the left side. If it's bleeding on the left side, you'll probably get weakness of the right side. So that's how stroke works. So early warning signs of stroke, if someone is going to have a stroke or let's say heart attack in the near future, some of the symptoms, some of the signs that you see, you feel that will make you say, oh, let me see my doctor because of what I'm feeling, how I'm feeling. If you having mild chest pain that comes and go periodically, it's a concern. If you having discomfort in your arm, any of your arm, your back, your neck, your jaw, if you're having nausea or abdominal pain periodically, it's time to see your doctor and tell your doctor about all these signs. If you're having dizziness frequently and with light headache, it's time to see your doctor, talk to your doctor so your doctor can do a proper assessment and do some diagnostics tests with you. If you start having shortness of breath, even with movement or without movement, please see your doctor. Those are some of the signs that a stroke is in the near future or a heart attack. So you see your doctor. Don't minimize all these little signs because sometimes it don't just happen like that. We have been feeling all these little signs here and there, and we neglect those things. So it's time to see a doctor if you're witnessing all those signs. So if someone is around you is having a stroke, how do you know? Oh, if you yourself you feeling somehow and it's a signs of that you are in an active stroke about to hit, how do you know? There is an acronym called FAST, this word FAST, which means you have to look at that person's face for facial drooping, which means you can ask that person to smile. If that person smile and one of the face is down and the other side is up and the person cannot adjust it, and you yourself, if you feel like you're smiling, one of your face is numb, is not right, those are signs of that somebody is having a stroke. You ask that person to raise their arm, to raise their both arms up, and you see if one arm is weak, that's another sign that that person is having a stroke. Ask that person to speak. Check the speech of that person. If the person is speaking or you yourself you're speaking, you realize that your speech is somehow slur. Your speech is not clear. That person is not speaking the way they usually speak. What you do? Time, which means call 911. Time matter when somebody is having a stroke. You don't waste time because the earlier the better. If that person is given medical attention right away, call 911 right away. When 911 personnel they come, paramedics, they will start intervention. They will start treatment right away, giving that person a higher chance of surviving, a higher chance of preventing side effects, is preventing effects from stroke. Effects from stroke is very debilitating. gives you weakness. One side weakness, just really weak. You can't do nothing. Some people, both a generalized weakness. You can't do nothing. And even death. So that's a little lecture I have today for stroke. For everybody to understand in a simple way, for all of us to understand, even in our homes, what we can do if we see our loved one having all these signs. We need to act immediately. Call 911 immediately. Don't try to drive this person to the hospital yourself. Call 911, because when 911 arrive, they start medical intervention right away. So thank you all. Like and subscribe for more videos. Thank you.